We preserve fertility and hormone function for those that are undergoing potentially gonadotrophic treatment. So those are mostly cancer patients or those with hematologic disorders that will have life-saving treatments, but might render them infertile later in life. And so we, as a comprehensive part of their care, consider what their quality of life might be like in the future. And so we want to preserve their fertility.
This really is going to provide opportunities for children in their future that do not exist today. And that really is the opportunity to have a child of their own in a way that was previously not possible and perhaps not considered. For male patients who are over about 12 or 13 who've already gone through puberty, they might be able to bank sperm. That's not going to require an operation, but it does require some thoughtful counseling with that child and family for them to understand the process. And it's a sensitive thing, and the child needs to be able to understand and comprehend that. And that could secure that child's reproductive future, just even one good banking session. That's very different, though, if you talk about a child who's 4 years old, who's very young, prepubertal, and can't do that and does not make mature sperm. And that child would need a surgical procedure to take a small biopsy from the testicle. Conversely, the girls, if that child is prepubertal, under the age of 11 or 12, she's not having a monthly period, her ovaries are in more of what we call a quiescent state, the option would be to remove an ovary and freeze that tissue for future use. Whereas if she is having a monthly cycle and she had the time to allow it, she could have some hormone injections and have a procedure to just draw out eggs from the ovary that could be frozen.
Standard procedures for ovarian tissue cryopreservation historically have been established for adult women and performed in adult REI clinics. The pediatric ovary is not just a smaller adult ovary, and in fact, there are a lot of nuances that we're now discovering because we have the opportunity to. We have gonadal tissue processing specialists that have been certified through our standard operating procedures that considers also the age of the patient and the size of the ovarian tissue being cryopreserved. They specialize in handling the tissue carefully, being mindful that this is the bank of potential eggs that could be used later on to create a biological offspring, and freezing that tissue appropriately.
Even if they didn't want to use the tissue for their own family purposes, to have their own hormones restored. Those are opportunities that for a child who is 4 or 5 years old, previously that was not the focus and did not exist. I really look forward to the day that we have an adult patient who comes back to us with her own child, and it's because of the care she got here.